Right. Chapter 8, we are going to focus on different types of vitamins, why we need them, and what happens if we don't get enough of them. So our learning outcomes are really knowing the difference between the water and fat-soluble vitamins, knowing what their functions are, and what happens when we don't get enough of them. So why do we need vitamins overall? So first of all, for fluid and electrolyte balance, that's going to keep our sodium, potassium, chloride, and phosphorus kind of in check. That keeps osmosis and movement of water in and out of our cells normal. Bone health is an important one. Of course, we think about vitamin C, or vitamin D and calcium for bone health, but also very important to bone health is vitamin C, phosphorus, fluoride. So again, a lot of our vitamins help with bone health. Brain health is one of the biggest ones, as you'll see here in our laundry list. Almost all of the vitamins that we're going to talk about today are needed to maintain our normal brain health. Blood health, so thinking about blood clotting, especially. So multiple vitamins are needed, as well as transporting oxygen. Our immune system relies heavily on vitamins. So typically if someone's getting a cold, we'll hear, take some extra vitamin C. And that's true, but a lot of other vitamins are important to good immune health. And finally, energy balance. So maintaining proper, ATP levels and cellular respiration and our mitochondria to keep all of our enzymes nice and healthy. So what is a vitamin? It's a carbon-containing substance that's needed in small amounts. So we don't need, it's not like calories that we're consuming large amounts of carbs or protein. So we have to have them. However, we just need them in small quantities. Vitamins are essential. Again, essential just means we can't make them. Since they can't be made by the body, we have to take them in our diet. So in order to be classified as a diet, the two main things, so again, the body can't make enough to maintain health. In the absence, and we're talking about a prolonged, not just missing a day, but a prolonged absence of that vitamin causes some type of deficiency, and that deficiency can be cured if putting the vitamin back into supply. Now we also, even though they are required, again, it's in small amounts. So we will talk about upper limits and upper levels, or what are referred to as mega doses, because some of them we can take too much and they can become toxic. And then our food or synthetic sources, again, have the same health benefits. So we'll talk a little bit at the end of the next one about supplements. So again, consuming within our foods are the most efficient way. All right, so our classifications, so vitamins are either fat soluble, meaning they don't dissolve in water, they need to dissolve in lipids, or they are water soluble. As you can see, the majority of them are water soluble. So if you can remember the fat soluble ones, the rest of them are water soluble. So the fat soluble are all vitamins. So we have A, D, E, and K. So those are all the fat soluble. So maybe come up with a mnemonic or something to help you remember those, make up a name out of them. But again, so you can remember the fat versus the water soluble. And then again, everything else we'll talk about are water soluble. So we'll be going through all of these, learning what their function is, and then what happens when we don't have enough of them. All right, so with our fat soluble, again, the main difference here, obviously how they dissolve, but also how they're stored. So fat solubles are going to be absorbed by the dietary fat. So instead of hanging out with all of the water, it's going to be transported and stored and kind of processed like our triglycerides and our fat molecules were. So anything that interferes with fat absorption will also impair fat soluble absorption. So different medications or things like that that alter our fat absorption will limit the amount of fat soluble vitamins we can absorb. Now the water soluble, these are mainly going to be processed like the other foods that we've mainly talked about. So they're mainly absorbed in the small intestine, high bioavailability, which just means a lot of them get absorbed. So bioavailability is the percent that gets into the blood based on what was given. So if you take a vitamin C and all of it gets into the blood, that's 100% bioavailability. Now, once in there, they're transported to the liver using that hepatic portal vein, and then the liver distributes it into the blood, into the body tissues. Now, once they're inside of the cell, these active coenzymes can be remade. So often they are not activated until they're in the cell or into the liver. All right, again, we'll talk some about the vitamin toxicity, especially an issue with the fat solubles, because they're going to hang out with our fat. They're not going with the water in our urine. So especially vitamins A, D, and E are not readily excreted, which means they can build up in the blood. So that toxicity, especially with vitamin A, is the one we talk the most about or worry the most about. Again, it gets stored in the fat. So if we keep consuming large amounts of them, it does store up and can cause some problems. Now, we don't really see this with water-soluble vitamins because they're excreted in the urine. So if we take more, we just excrete more. Now, the exception, though, to that is vitamin B6 and vitamin B12. And this is because they actually get stored in the liver instead of being metabolized and processed and excreted with the urine. It still happens, but it's stored. The liver stores these in larger quantities. So this is most frequently seen whenever supplemental sources are being used. So it's really hard to reach that upper level just by eating foods. We see these whenever vitamin supplements are taken and too much are taken, or they're taken in large quantities, which is called a megadose. So vitamin C, we see this a good bit, where vitamin C, it'll say 100% of the daily recommended value, but it's actually giving you 200 or 300% of what you need. And so people are like, oh, well, if 100% is good, then 200 is better. That's not necessarily the case. So that's what we refer to as a megadose. All right, so just a little bit here about preserving vitamins in foods. So the content is greatest whenever the fruits and vegetables are ripe. So if they're if they're not quite ripe, thinking like a banana or something like that, or a peach that's still really hard. So if they're not quite ripe, that indicates that they haven't reached their peak in producing vitamins. Freezing actually helps to retain the nutrients. So sometimes those are blanched first, which means they're just boiled real quickly. That increases the vitamin content, and then they can be frozen. So just understanding freezing doesn't denature or harm the vitamins. It does help preserve them. Now the water-soluble ones are particularly susceptible to destruction, though. So again, boiling them, steaming, heating too much can actually destroy the vitamins, especially the water-soluble. Also exposure to light and air, again, cooking in water, and high pHs, so more basic pHs. All right, just looking here at the MyPlate sources as far as vitamins, and we'll also talk about choline. So essentially all of the food groups help provide some of our vitamins. So again, as long as we are consuming that recommended, all of the variety of foods in each of the food groups, then we are obtaining all of the vitamins that we need. It's whenever we're not consuming enough or not the right ones, that's whenever we start seeing those deficiencies. All right, so starting off with vitamin A. So these are also called retinoids. We see this a lot, especially talking about the eyes or even aging. So we'll talk about retinols with the anti-aging creams. There are actually 3 active forms of vitamin A. So retinol, and then retinoic acid. And these are only in animal products. Okay, so these are not going to be forms that we see from plants. Now, the vitamin A gets stored as retinol, and then it gets esterified into a fatty acid. So this one, again, is a fat-soluble one. It actually looks like a fatty acid, and that's called the retinil. It actually gets put into the membranes of our cells. Now in our supplements, the vitamin A is listed as retinol acetate or retinol palmitate. That's because it's already attached to a fatty acid. That's what helps it get absorbed. And then the body processes it to that active form and releases that retinol or retinal so that it can actually work. Also, we talk here about the carotenoids. So now these are in the plants. So those plant-containing pigments are called carotenoids. It gives them their color. These are phytochemicals. So if you remember phytochemicals, there is not a recommended daily allowance. They are not considered one of our main nutrients. We don't have to have them, but they do have a lot of health-promoting effects. So these carotenoids, the reason especially we're talking about them here is they're precursors of vitamin A, and they have these antioxidant properties. So these can be used to help make vitamin A, but by themselves are not considered vitamin A. So the three carotenoids that are provitamins, which just means they can be turned into vitamin A in the body. So again, vitamin A only comes from animal sources, but eating these plant sources also can then be used to make vitamin A. So the three are beta carotene, alpha carotene, and beta cryptoxanthin. Now there are a few other carotenoids that are more the phytochemicals that provide health benefits, lycopene that we see especially in tomatoes, zeaxanthin, and then lutein. All right, so what are some of these functions of vitamin A? It's mainly in the epithelial cells, so looking at immune function especially. So epithelial cells, those are the cells that line all of our surfaces, so like the eye, the skin, the lungs, all of our openings. So these are important to being barriers to infection. So if the bacteria or virus can't get in, it can't cause an infection. So we need good, healthy epithelial cells. So that retinoic acid is required for immature epithelial cells to become mature. So as they're developing, in order to become a mature epithelial cell, we need that retinoic acid. So we need vitamin A. So what happens whenever we don't get enough of it, so that deficiency, there's a kind of mucus forming cells deteriorate. So we're losing that mucus that lines, especially like our lungs, but also the stomach that provides protection. It also leads to dry eyes and blindness. So we talk a lot about this with blindness. It can cause hyperkeratosis, which is whenever those skin cells make too much of what's called keratin, which is a protein, and that actually blocks the hair follicles, and the skin gets really hard and dry. And then it also supports T cells that are important in our immune system for helping activate or treat bacterial or viral infections. All right, so again, I mentioned we'd talk about it with blindness. So actually vitamin A deficiency is the leading cause of blindness in the world. So about 1/3 of children worldwide suffer from a vitamin A deficiency, and hundreds of thousands become blind each year because of this. And then the picture to the right there is showing a severe effects of dry eye or xerophthalmia in the eye, which is commonly a problem in Southeast Asia due to this vitamin A deficiency. So of course, vision, we hear, your carrots as far as helping to prevent blindness. Again, carrots have beta carotene, and beta carotene can then become vitamin A. But this is especially important in age-related macular degeneration. And the picture over here shows what it looks like for somebody if they have macular degeneration. It gets blurry, but they also have spots where they just have no image at all. So these are changed in a part of the retina called the macular area, hence the name macular degeneration. But it does lead to blindness, and it's the leading cause of blindness in older adults, especially associated with lower levels of carotenoids in the diet put you at greater risk. Doesn't necessarily mean it, but it does increase the likelihood. So eating green leafy vegetables are the biggest sources of that rich lutein, which again can help with the carotenoids to prevent this. Some other functions of vitamin A, as far as growth and development, is very important. So vitamin A binds to receptors on DNA that increase synthesis of different proteins, and those proteins are needed for growth. So not having them then hinders growth spurts. Again, differentiation and maturation, so becoming a mature cell that ultimately forms the tissues. So again, stunted growth is something that's seen especially in children if they don't get enough vitamin A. And then as far as fertility, it also aids in sperm production and the normal reproductive cycle. So think about ovulation in women. So again, also important in reproduction. So how do we get enough vitamin A? So the American diet typically contains plenty of sources of vitamin A in the preformed that can then be activated. So again, the preformed versions, so the retinoic acids. So good sources. So again, these are from animal sources. So liver, fish, different oils, fortified milk. Fortified just means it's been added to it. Butters and yogurts, eggs, margarines, and spreads. So remember, again, it's fat soluble, so it's in fatty foods. But again, also its reserve stores are there in the liver. That's why consuming liver from other animals contains a lot of it. What about the carotenoids? So again, this is in our plants. So dark green and also yellow orange vegetables. Again, think about our carrots or tomatoes, provide that beta carotene. Green leafy vegetables like spinach and kale have that lutein and the zeaxanthin. And again, our tomatoes have that lycopene. So cooking frees the carotenoids, and that actually helps them be absorbed a little bit better. So the eating cooked tomatoes actually provides more of lycopene than the raw. All right, now again, this is the one we worry the most about with toxicities and too much. So that upper limit, the UL, is about 3,000 micrograms of what's of RAE, so the recommended allowance. Just kind of putting that into perspective. So about 4 ounces of the polar bear liver will deliver a toxic dose of the vitamin A. So I don't know too many people probably that eat the liver of a polar bear, but just kind of putting it in perspective, it wouldn't be that much in order to cause toxicity. So excess leads to liver toxicity because, again, that's where it gets stored. So too much of it damages the liver. It also increases the risk of a hip fracture, and it can cause some problems during pregnancy. So it can lead to birth defects from fetal malformations and also spontaneous abortions if too much vitamin A is consumed. So women in childbearing age should actually limit their overall intake of the vitamin A, so not taking vitamin A supplements and not consuming more than 100% of that daily allowance. So avoiding too much of the carotenoids, so in our plants. So again, excessive dietary consumption does not have a toxic effect. So if you ate too much liver, that would be damaging, but eating too much carotenoids is a little harder because, again, they have to be converted to vitamin A. So our body wouldn't convert them to vitamin A if we had enough of it. However, hyperkerotinemia is like too many carrots or beta carotene, but again, in supplements and in pills. So what happens is the skin actually turns that yellowy orange color like a carrot, especially on the palms of the hand or on the soles of the feet. As little as 4 or 5 large carrots daily can actually produce that. So taking a break from carrot, squash, pumpkins, those orange, will put everything back to normal. All right, so moving on to vitamin D. So the fat soluble, again, it's also essential. It's actually a hormone. So this is one of the odd ones where it's, of course, a vitamin. It does things, but this one particularly is a hormone. It helps regulate other molecules. This is the one that we need some light exposure. So it's produced in the skin only when exposed to UV light. So getting plenty of sunlight is important for activation. Cholesterol actually is a precursor to vitamin D. So consuming cholesterol like the carotenoids for vitamin A, cholesterol helps provide vitamin D. And we rely on the activation of we rely on the liver and the kidneys to activate it to its active form. In a couple different forms, so there's vitamin D2 and vitamin D3. So D2 is derived from irradiation of plant sterols, so called ergosterols, and it can be used as a supplement. And whereas vitamin D3 is more commonly what's used to fortify our foods, just meaning, again, it's added to foods and to different supplements. So where do we get the vitamin D? So again, this 7-dehydrocholesterol is the precursor that's in skin. So again, providing cholesterol helps provide vitamin D. And then it gets activated or converted into the D3 form whenever we get that UV exposure. So then both D2 and D3 go to the liver. It gets converted into another molecule called calcidiol. And that's the main form of vitamin D that's actually in the blood. So we go from cholesterol to vitamin D3 and then activate it into this calcidiol to actually regulate it or provide it in the blood. Now then it gets converted in the kidneys to calcitriol, and that is actually the biologically active form of vitamin D. So we go through a couple of different phases to actually activate our vitamin D. And that's just being shown here. So again, our dehydrocholesterol, that precursor, whenever we're exposed to the sun, that converts it to vitamin D3. And then also that and vitamin D2 that's in some of the synthetic versions. Both of those ultimately get converted by the liver to calcidiol or calcifediol. And then our kidneys actually convert them into the active form that can be used. All right, so why do we need vitamin D? Again, this is really important with our calcium and our bone health. So it maintains calcium, but also phosphorus levels. And we need those to help with gene expression, which is using DNA to make proteins. Those proteins help our cells grow normally. Neuromuscular and immune functions, as well as helping to reduce inflammation. So again, it is one that was on multiple lists at the beginning of all the functions of vitamins. So very important for immune health, our brain and mental health, skin, muscles, and reproductive organs. Again, it is a hormone, so it controls growth of the parathyroid gland, and it actually has been shown to maybe decrease the risk of certain types of cancer. All right, now its role in regulating calcium. So it regulates the absorption. So if you just consumed calcium and didn't have vitamin D, very little of the calcium would be absorbed. So we need the vitamin D to increase the amounts of calcium and also phosphorus through the small intestine. That parathyroid and calcitonin, which are other hormones, helps to regulate the calcium excretion in the kidney. So again, controlling it coming in and going out. So it causes the kidney to reduce calcium excretion, so it retains it. And then it affects the deposition or withdrawal of minerals from the bone. So again, bone health is really important. So it releases calcium from the bone by stimulating osteoclast activity. And those are the ones that are breaking down bones so they can be rebuilt. All right, and then just kind of a visual here to see it. So again, that active form of vitamin D, which is a hormone. So again, we're increasing calcium and phosphorus absorption here in the small intestine. It decreases the excretion in the urine, and then it increases this osteoclast activity that releases calcium into the bone. So it's overall increasing the amount of calcium and phosphorus in the blood. Now, what happens when we don't get enough? So the small intestine only absorbs about 10 to 15% of calcium consumed. So if we don't have enough vitamin D, essentially it leads to a lack of calcium. So then not enough calcium alters our bone health as well as other functions as well. So it's especially something to the deficiency risk increases in darker skinned individuals, those that with a low vitamin D diet, those exclusively breastfeeding infants. So again, we get this from milk, the elderly, not being in the sun to activate that cholesterol to vitamin D, and diets without fortified foods. Right, vitamin D deficiency also leads to what's called rickets. So this is especially something that occurs in infancy and early childhood. Thankfully, not so much in the United States due to our diets, but especially in developing countries. So because of that, again, enough calcium doesn't get absorbed, so skeletal abnormalities occur, so like bow legs, thick wrists, ankles, curvatures of the spine. Besides rickets, also osteomalacia or soft bones, which occurs in adults, and this is from inadequate calcium uptake. So then that leads to more brittle bones that are more easily or more likely to break. So some of our sources of vitamin D, so fatty fish, again, this is a fat soluble, again, eggs, butter, fortified dairy, fortified breakfast cereals, and mushrooms that have that ergosterol that has cholesterol that can be converted. So again, avoiding too much, there is an upper limit of about 100 micrograms. Again, I'm not going to ask you the numbers of these, just understanding the ones that you can have too much of that lead to toxicities. So it essentially results in too much blood in the calcium. And so that, though, does not occur from sun exposure. So being in the sun too long doesn't make it in. Our body we put limits on what we convert if we have enough. But some things to look for those toxicity symptoms. So weakness, loss of appetite, essentially GI distress, so diarrhea or vomiting, confusion with our mental health, and an increased urine output trying to get rid of it. All right, so now moving on to our vitamin E. So tocopherol, this was identified actually as essential for rat fertility in 1920. That has not been seen though in humans. However, it does have multiple functions. So it helps with muscles, the central nervous system, so our mental functions. It's an antioxidant that helps protect our DNA, and it maintains that nervous tissue as well as immune functions. So again, what an antioxidant here, so it's fat soluble, so it's stored with fat in the adipose tissue and also in our cell membranes. Those membranes are polyunsaturated, meaning again, multiple double bonds in there. But these fatty acids are susceptible to oxidative attack, meaning these molecules attack those fatty acids. So essentially what happens to protect them is that vitamin E donates electrons or hydrogens to what are called these free radicals, these oxidative molecules that occur from exposure, and it stabilizes them. So then it prevents those free radicals from damaging our DNA or other proteins. So this is especially important in areas exposed to high levels of oxygen, which lead to these free radicals or these oxidative molecules. So like our red blood cells in the lungs is where we see those occur the most often. So a deficiency in vitamin E is actually pretty rare because vitamin E is so common in all of our plant oils that, again, as long as we have a normal diet, it's easy to get these. Populations, though, at risk, preterm infants. So as the transfer of vitamin E from mother occurs later in pregnancy. So again, if it's a preterm, they didn't get that vitamin E from their mom, and it can potentially be dangerous. So that oxidative damage, though, could cause the red blood cell membranes to break. That causes hemolysis and a lot of problems with the blood. Also, smoking destroys vitamin E in the lungs. So smokers should take or consume more vitamin E than others. And then that fat malabsorption disorders, though, or very low fat diets can limit the amount of vitamin E. So how do we get enough? So again, those plant oils are the best sources. So salad oils, margarines, shortenings, fortified cereals, and then our nuts and seeds. can't have too much, but it's a pretty large dose there. So 1,000 milligrams per day. There is an upper level. So mega doses do not provide significant health benefits. So again, taking more than what you need in a day doesn't like make them better. It doesn't, make them work in more effect. We just need what we need. It is not stored though in the liver. It's stored in the fat tissue. And then that excess though can interfere with vitamin K and anticoagulant medicines like warfarin or Coumadin, also aspirin, that are used. So that excess hinders vitamin K that has these properties. So the supplements, again, just the risk of drug interference and prolonged bleeding. Again, if vitamin K is not doing its job, we bleed out. And it can also cause nausea, GI distress, and diarrhea. All right, our next vitamin is vitamin K. There are quite a few different forms of vitamin K, and actually about 10% gets made by our gut bacteria. Now, some of the functions, as we mentioned when we were talking about vitamin E, vitamin K is important in blood clotting, also bone health. As far as blood clotting, it helps with the process of some molecules called thrombins and fibrogens. These come together to make the clot. So in order for that to happen, vitamin K is needed. So problems with or lack of vitamin K can lead to bleeding disorders, but it's also important in our bone health. So it depends. So the osteocalcin, which is involved in our bone health, needs vitamin K to actually mineralize, so to harden our bones. Our highlight here to our microbiome. So of course, we've talked a lot about different benefits of the bacteria in our gut, as far as helping digest food, and our immune system protecting, of course, against disease and other health benefits. But also here in this chapter, talking about vitamins, our microbiome also helps actually make vitamin K, vitamin B12, thiamine, riboflavin, and biotin. All right, so what happens without our vitamin K? So in infants, the gut is sterile, so there are no bacteria in the gut. So if the infant is injured or needs surgery, they cannot make vitamin K for that clotting, because again, they're dependent. Of course, they're not eating food, so they're dependent initially on those gut bacteria to help as they get established through breast milk or formula that adds some of that microbiome to help them get established, that makes that vitamin K. But early on, until they have enough, until their microbiome is built up, they can't make enough vitamin K. So in those situations, vitamin K is actually administered by injection soon after birth to help set that up. Now in adults, the deficiency occurs whenever there's a long-term antibiotic use, and again, that and hinders our microbiome, that can then lead to deficiencies. And then it's fat soluble, so anything that alters our fat absorption can hinder the uptake of vitamin K. So how do we get enough? There's not an upper limit, so there's no toxicity. We can't have too much vitamin K. However, some issues here, the drug Coumadin or warfarin, it's an anticoagulant, so it's often used with individuals who have heart problems to keep their blood kind of thin, and after surgeries to keep clots from forming. However, what it does is it inhibits vitamin K coagulation, so it's an anticoagulant. So whenever taking that medicine, that's a time that individuals would want to limit their vitamin K. Otherwise, they're kind of offsetting the drug and it may not work appropriately. Where it comes from, so again, it's fat soluble, so the liver is going to be involved there. So consuming liver helps consume vitamin K, but also those dark leafy vegetables, broccoli, asparagus, peas. These are resistant to cooking losses, so it maintains and stays throughout the cooking process. Again, it's absorbed by those dietary fats, and we need those pancreatic secretions and our enzymes to help release it. Now, in older adults, they can have a lower vitamin intake because they intake less vegetables as their appetite decreases.